Dear colleagues, I'm Teresa López, cardiologist at La Paz Hospital in Madrid, and on behalf of the Spanish Cardio-Oncology Working Group, I would like to welcome you to this first Cardio-Oncology course for residents and fellows, co-hosted by the Spanish Society of Medical Oncology, the Spanish Society of Radiation Oncology, the Spanish Society of Hematology, and the Spanish Society of Cardiology, and endorsed by the International Cardio-Oncology Society. I would like to take this opportunity to thank all the sponsors who have supported this meeting, of course, the speakers who have kindly agreed to present, and Cristina Plaza for her continuous technical support and help in organizing this meeting. As you know, the aim of this course is to improve our understanding on how cancer and cancer treatments impact cardiovascular health and how cardio-oncology practice helps to prevent cardiovascular toxicity. And for that purpose, today we have a large panel of cardio-oncology experts, but most important, we have the pleasure of being joined today by Dr. Susan Dent. Susan Dent is medical oncologist and co-director of the Duke Cardio-Oncology program at Duke University, and she's the founder and the past president of the Canadian Cardio-Oncology Network and the current president of the International Cardio-Oncology Society. So thank you, Susan, for joining us.
Thank you.
My first question for you is, what is cardio-oncology?
Thank you, Teresa. I mean, that's a very basic question. You know, what is cardio-oncology? I think that when we think about this new term, you look at it and you think cardiology and oncology and bringing those two subspecialties together to try and take care of patients with cancer who have cardiovascular risk factors or cardiovascular disease as they're starting their treatment or even during their treatment and into survivorship. So how can we collectively, take care of those people? So it's an all-encompassing term that really refers to individuals who are invested in taking care of cancer patients with cardiovascular issues. However, I do want to point out, even though it's cardio-oncology, it's really important to recognize that we work as a healthcare team. So it's cardiologists, oncologists, nurses, pharmacists, exercise physiologists. We have to think about all those people who form part of the team. So I would say it's healthcare providers who are invested in taking care of patients with cancer, with cardiovascular issues.
No, thank you, Susan. I think that one of the most important things you say is that we need a team. So cardio-oncology is not cardiologists in their office or oncologists in their office try to refer patients. So we need to be able to work all together. And what do you think are the most important benefits of a cardio-oncology program for our patients?
I think one of the important benefits is that by working together, we can try and ensure that our cancer patients have the best possible cancer therapy. So we know that there's been huge advancements in cancer treatments, and we're moving away from chemotherapy to targeted therapies, but those targeted therapies have unique side effects, many of which affect the cardiovascular system, whether it be arrhythmias or hypertension, the known heart failure or myocarditis with immune checkpoint inhibitors. But unless we work together in teams, where it's going to be very challenged and very hard for us to treat these patients because of the potential complications that they may have. So as an oncologist, what I would like from this team is to help me ensure that I can give my patients the best possible cancer care, obviously with the ultimate goal of curing people of cancer or, for those with more advanced disease, extending their life. And by that, I mean with quality of life.
Yeah, thank you. I fully agree with you. And in general, because when cardio-oncology borns, it seems that all is about doing echoes for patients that are treated with anthracyclines. And now the spectrum of cardiovascular toxicity is more broad, of course. But currently, which patient do you usually refer to the cardio-oncology clinic?
That's a good question. So, I'm a breast cancer oncologist. And so I still use anthracyclines for some of my patients. I use HER2 targeted therapies such as trastuzumab and pertuzumab. So, there I look at my cancer patients on the spectrum of their cancer journey. So I think it's important, and how I look at my practice is at the very beginning, prior to starting their cancer therapy, who are those patients who are at risk? And if they come into my practice with a history of breast cancer that I need to treat, for instance, are they, they have pre-existing cardiovascular disease or cardiovascular risk factors? So I certainly like to refer those patients up front who I think have high cardiovascular risk or risk of experiencing a cardiovascular toxicity. And then, of course, I have patients who started their treatment and they run into trouble on their treatment. So they may have been fine when they started their cancer therapy, but then they may have drops in their ejection fraction, or they might develop poorly controlled hypertension, and I need to get those patients seen. And then finally, and I think probably the biggest population and the ones that we really need to work on more is survivors. And, those patients who have long-term sequelae from their cancer treatment, we can't forget them. I try and get those patients seen if they have long-standing complications from their cancer treatment. So I think you have to look at the entire cancer journey. I think that, oncologists in the past have been very reactive. They've waited until their cancer patients developed a problem. And so that led to maybe stopping of the cancer therapy. But I think what we need to do is be much more proactive. And we need to consider screening our patients and risk stratifying them at the beginning so that we can avoid some of the cardiac complications that we see with modern cancer therapies.
Yeah, I fully agree. I think that this is very important to stratify the risk for cardiovascular events and before to start cancer treatment. And of course, this risk stratification, as well as other management of cardiovascular problems during and after cancer therapy, requires a specific training in cardio-oncology because, of course, we as a cardiologist, from the beginning, we are not aware of the different types of cancer therapies, and probably we need to have at least a basic knowledge of what are the potential expected cardiovascular side effect. So how do you think we need to organize this basic cardio-oncology training for our residents in cardiology and oncology, etc.?
I think that it's very important to look at training of future physicians, future healthcare providers, including nurses, even pharmacists. I think we need to go back further, almost at the level of medical school, to be honest with you. We need to start looking at medical school curriculums and investing in medical students to show them the importance of cardiovascular disease and cancer. I mean, if you look globally, those are the number 1 and 2 causes of morbidity and mortality in the population worldwide. And yet we have considered them in the past as 2 distinct things, cancer or cardiovascular disease. And so we need to start thinking about how they work together. And you're right. I mean, when we go through, if we move beyond medical school into residency and fellowship, we tend to be very siloed in our training. We tend to look just after the cardiovascular aspects or the oncology aspects, and we don't break down those barriers and look at how the two interconnect. And I think what I've learned over the last several years is that you have to treat the whole patient, but the patient doesn't happen to operate in silos. We may be in silos, but the patient is not. So if I give this cancer therapy to my patient and it causes a cardiovascular complication, then I need help from my colleagues who understand the importance of that cancer therapy and how they can manage that cardiovascular complication. So it really is the intermingling of the two. And I think that we do need more training and to emphasize the interconnection of the two. And really, it speaks to more of a holistic approach to how we take care of our patients.
And in that aspect, I think is also very important to try to minimize cancer treatment interruptions, because sometimes, at least in Spain, in some centers, there is not the same involvement in the cardio-oncology practice from oncologists or from cardiologists. So the fact that we were able to work together facilitates cancer treatment because minimizes the risk of unnecessary interruption of cancer treatment. That I think is another important aspect.
And I think, Teresa, fortunately for some of our patients nowadays, we can offer them what I'll call life-sustaining treatment. We may not be able to cure them of their disease, but people are living longer with cancer. But they can only do so if we can manage or at least prevent some of these toxicities. And we are referred to my practice periodically, patients from community cancer centers who don't feel comfortable treating these patients because, for instance, maybe their ejection fraction is too low and they're going to give them a therapy that might make that worse. So we need to learn how to work together so that we can continue, right, seeing the great gains we're making in cancer therapy, but we're doing so in a way that's not compromising cardiovascular health. And that only comes by working together as a team.
Yeah, thank you, Susan. So, as you know, today we have a large audience of young oncologists and cardiologists, and I want to take the advantage you are here to ask you to present or to summarize for them what is the International Cardio-Oncology Society and what kind of activities ICOS carry out and how our resident and fellowship can join our International Cardio-Oncology community.
Thank you, Teresa. Yes, the International Cardio-Oncology Society is truly a global organization of healthcare providers from all over the world that are interested in advancing clinical care for our patients with cancer and trying to prevent, not only treat, but learn how to prevent cardiovascular toxicity. And this organization is invested in enhancing clinical care, education of healthcare providers, as well as patients, and research. What can we do to advance this field of cardio-oncology? And over the last few years, I'm happy to report we've seen a huge increase in interest from around the world. We now have close to 700 members globally, and we have 21 chapters from around the world. These are countries who have their own cardio-oncology programs who are working with us to try and advance patient care. Within our organization, we have a number of committees, such as a scientific committee, an advocacy committee, an education committee, and then we have the Global Cardio-Oncology Summit, which is our big annual meeting committee as well. And then we have a number of working groups looking at with nurses, pharmacists, exercise physiologists. And so you can see from this amount of activity, there's a lot of great work that's going on. And importantly, we want people who are interested in this space to work with us. And so if you go to the ICOS webpage, which is ic-os.org, you will see that there is an application form on that website where you can apply to be involved in one of these working groups or committees. And finally, I want to just point out how important education is. We have monthly webinars, we have ongoing seminars. We're very invested in our fellows. We have advertised fellowships that are available worldwide. And we have a cardio-oncology exam, which is really dedicated to try and improve everyone's knowledge and to recognize those people who've acquired a certain level, basic level of cardio-oncology knowledge. And finally, and importantly, a recent initiative has been the Center of Excellence. So centers who have a cardio-oncology program can apply to ICOS to become a center of excellence based on their clinical care, their educational initiatives, and research. So there's a huge amount of work going on in this organization, all to promote care of our cancer patients. So I would say if anyone's interested in working with us, please feel free to visit the website, and we're more than happy to entertain any of your ideas. There is more than enough work to be done in this space. I think you'll agree, Teresa.
No, definitely. I think that there is a really amazing activity, educational activity created by the International Cardio-Oncology Society. And in fact, I recommend all of you to join the weekly webinars because they are prepared for a large audience. So as Susan said before, it's not just focus on cardiology areas or oncology areas. We have a large group of nurses and exercise physiologists. So I think that this weekly webinar cover the broad spectrum of cardiovascular toxicities and cardio-oncology needs. And in fact, Susan, I want to tell you that today, at the end of the day, we have a cardio-oncology clinical case quiz. And we ask our residents to create mini cardio-oncology teams. So the team that wins this competition, we are going to offer them a free registration for the next Global Cardio-Oncology Summit in October this year. So we hope that we can also promote all the international cardio-oncology activities with this course.
Yes, that's fantastic, Teresa. We have not been able to have that meeting in person because of the COVID pandemic for the last 2 years. But this year in Toronto, Canada, we will have it as a hybrid meeting, both virtual and in person. The other opportunity will be for fellows and trainees to submit abstracts. So the call will be coming out shortly, and we strongly encourage you to consider that. It's a great way to showcase the work that you're doing and to interact with your colleagues.
Yeah, definitely. So thank you very much, Susan, for your time and for all your inspiring work about cardio-oncology. And thank you all for attending this meeting today. And I will now hand over to Isabel and Raul to start with the first session. Thank you.